I was in a coma for like 3.5 months, and then like an extra month just waking up and like trying to like exercise a little bit, and then to rehab for 2 more months.
Wow. So looks like he developed a lot of burns after this car accident, so much so that he can't even hardly open his eyes. Let's get a bit more of his story and break down what's going on and what they do to help him.
I have a colleague who works in New Jersey. He's a plastic surgeon, and he called me to let me know about a patient that he had been taking care of for numerous months. He had had numerous operations, probably over 20, of his face and his hands, and they began to entertain the possibility of a face transplant or hand transplant.
Not that long ago, I did post a video about one of the first face transplants that was ever done here in the United States. And these operations are long, they're extremely complicated, but they actually do work in the right patient. So what's the difference between a transplant and, let's say, a free flap or a graft? Well, grafts and flaps essentially are tissue that you move from your own body, let's say from the lower part of your body to the upper part of the body. And so we can do that with skin, a skin graft, or you can actually do it with various muscles or other body parts. So for example, we can take a part of the fibula, which is a bone in the lower leg, and we can use that to reconstruct the jaw. But in these surgeries, you're using tissue from the same patient. In a transplant, you're actually taking tissue or a body part from another person and putting it into your own body. And this increases the amount of difficulty, the complication rates, and how long the operation will be exponentially.
And I think the main issues were that he was essentially a functional cripple. He was completely dependent on care from his parents, and they did not feel that there was end in sight.
So one question you may be answering is, what happened to his eyes? Well, it looks like he had burns throughout his whole face. And one of the things that we worry about when you've got facial burns like this are your eyeballs. Have they survived, and how do you actually prevent them from drying out? Now you can see he's got kind of a band of tissue that goes from the upper part of his eyelid to the lower part of his eyelid. And I don't know his medical history, but it's possible that this tissue was actually put there on purpose to prevent his eyeballs from drying out. If his eyes dried out, then he can actually lose his vision from it, and obviously that's a massive, massive issue.
Now, he's an excellent candidate, but that does not mean it's going to be easy to find a donor for him. When we look at Joe's PRA, which stands for panel reactive antibody, his PRA was 94%. He essentially had a 6% chance of identifying someone that would be a proper donor for him.
So why does this matter? Well, whenever you're doing a transplant, it's so important that you have a donor who matches the actual recipient of that body part in a number of different, what we call antigens. There's blood type testing that needs to match. There's tissue typing, otherwise known as human leukocyte antigens, that need to match up. And you have to do a cross match as well. So if you don't do this matching and you do a transplant with somebody's body part, then your immune cells can attack that body part and not cause it to function. If you don't appropriately do this type of tissue matching and you do, let's say, a transplant willy-nilly, then your body's immune cells can attack that transplanted organ and essentially kill it off.
He sustained about 80% total body surface area burns. Most people with that amount of burns, they don't survive.
When I was in my surgical residency, we spent several months working in the burn unit of my hospital. And this was a really tough assignment, but one that I found to be so rewarding. But it is true, when you have somebody who has such a high percentage of burns that they come in with, their chances of survival are very low. I remember a young man who came in to the burn unit, and this was actually a story that I told in my first book, In Stitches, where he had burns in over 90% of his body. And he came in and he was actually awake. Even with all these burns, he was in such severe pain. But we know that when you have so much of your body that's burned like that, the body undergoes these fluid shifts that are absolutely massive. And so you need to fill them up with fluid because they lose so much of it through dehydration from all of those burns. But injecting so much fluid into somebody can cause their lungs to fill up with fluid and make it hard to breathe. And so before this young man was about to be intubated, basically put on the ventilator, he was still awake. And this is a story that honestly still haunts me to this day. I went up to the burn unit surgeon. I was actually a medical student at the time. And I said, look, this young man's wife and his daughter are in the waiting room. We're going to sedate him, put him on the ventilator. And you and I both know that he's unlikely to wake up after this, that he's probably not going to survive with over 90% burns to his body. So I actually asked the doctor, the burn unit surgeon, I said, do you think we should have his wife and his daughter say goodbye to him while he's still awake? And his answer, after thinking about it for a few seconds, was, no, let's give them hope. And so we put him on the ventilator. I actually went home a few hours later, and when I came back the next morning, he had died. And that was something that I always regretted because I knew that he was unlikely to survive, and I should have pushed harder to have that burn surgeon bring his family to him, because at least maybe they could have said, I love you, and goodbye at that time.
Now, this will be my 4th transplant, and Joe is a challenging case. There have only been 2 attempts in the world to do a face and bilateral hand transplants, and they have been unsuccessful.
So why are these operations so difficult? Well, essentially when we do, let's say, a flap, a free flap, where we take, let's say, muscle or bone from the lower part of the body and put it to the upper part of the body, or vice versa, we have to suture together those tiny blood vessels and the nerves so that blood can flow to that body part in its new location. When you're doing a transplant, you have a lot more blood vessels and nerves that you have to suture back together. And these are in a patient who it's not their original body part. So in a gentleman like this, you have to actually remove his original face, then you have to put the new face onto him, and you have to suture these nerves and blood vessels back together and hope that, let's say, those blood vessels don't coagulate, they get clotted up. Unfortunately, it's not as easy as what you see on Face Off, where you just put a face on somebody else's and it just melds together. This is much more complicated. So now when you're dealing with the hands, in addition to those blood vessels and those nerves, now you also have to suture all those individual tendons together. And that also can be very time consuming.
It's been a great privilege for me to be in this great adventure. For these gifts to happen to Joe, unfortunately someone has to pass, but we've been very fortunate to have a remarkable match.
In my residency training, I did help with a number of different transplant operations. We didn't do a lot of them, mostly kidney transplants back then, and oftentimes they would be transplanted from a live donor, sometimes a family member, into the recipient. However, there are those situations where the donors are people who die, and they are kind enough to donate their organs to somebody to help them survive. And back when I was in residency, and this was 20 plus years ago, there was this kind of odd gesture that the donor company, the company that actually facilitated all of this, would do for the hospital staff. They would actually throw them a pizza party whenever they would have a donor come through, which I could never eat the pizza, because even though there's happiness in the fact that somebody gets a donor body part and it helps them to survive and live a longer life, somebody died for it. And that in and of itself obviously is a tragedy. But it was a very odd situation where somebody dies and now you're in the ICU and you're celebrating eating pizza. It just is weird. I don't know if they still do that there, but it was definitely strange.
What I told my team is exactly what I felt. We've rehearsed for this operation, we're ready. We all know what we need to do and we will be successful. We completed the operation in 23 hours. We got Joe up to the surgical intensive care unit.
It is amazing how many people are needed for an operation like this to go smoothly. 23 hours, actually, when you think about it, you're doing an entire face and both hands. You probably have 3 completely separate surgical teams. My guess is for each body part, you've got at least 2 surgeons. So you probably have a good 6 surgeons. Each of them will have likely an assistant, either a physician assistant or a nurse that would be an assistant or a scrub tech assistant. And then you've got the scrub technician, probably for each of those operations. You've got anesthesia. It is a massive team, and every single person is necessary for this to go smoothly. It's not just the surgeon here, it's the entire team. And it's so important to give props to those members of the team who normally don't get it. Usually it's the surgeons who get really all the attention, they get all the glory and the thanks, but there are so many members of a surgical team that we cannot really do what we're doing and help our patients the way we want them to without those members of the surgical team.
So Joe, you know what we're doing today? We're going to kind of liberate you so we can let you look in the mirror. You have a big smile. See everything starting to move? Isn't that great? Open your mouth real wide. Good, close your teeth. Open your eyes real wide.
When you do nerve repairs, it can take literally months, if not even years sometimes, for nerves to completely regenerate. And we believe that repaired nerves regenerate at a rate of less than 1 millimeter per day. And so when you've got nerves, let's say, that are reattached down close to, let's say, the jawbone, and they go all the way up to the lip, it takes a while for those nerves to really work and to kick in. And that needs to happen, obviously, for the face to move normally.
Our physical therapy team and our hand therapy team is getting very creative with having them do fine motor skills.
The progress so far is actually really going ahead of schedule. So what I feel the most is it's my hands. 'Cause I really want the hands first. When I first met Dr. Akers, I said I'd rather get the hands done so I can get back to work.
So in order to get his fingers moving, it is so important for him to work with a physical therapist, specifically one that deals with the hands, because the hands are actually very, very complicated structures. You've got these tendons that glide in these tendon sheaths, and even a little bit of scar tissue can cause them to not glide naturally and can cause constrictions and other types of problems. And so really getting those hands moving very early is super, super important for his eventual function.
To Joe, this operation basically translates to independence and freedom. He's kind of breaking out of that shell that every person goes through when they're compromised, and he sees this kind of light at the end of the tunnel that he's going to be able to recapture and regain everything that he had prior to his injury.
What an impressive result. He looks amazing, and I really wish him the best. Well, I recently reacted to a video of the youngest face transplant ever, and this is a beautiful young woman who unfortunately suffered a severe injury to her face. How did she do after the face transplant? Take a peek at this video right up here, because you really want to see this after. And remember, eat real food, use clean skincare, and auto-juvenate before you operate.